You're most welcome, Honorable Minister.
Thank you.
So since 14th March, when the first case was discovered, and now, what is the current status of COVID in the country?
The current situation is that we have 11 cases of COVID-19. Specifically today, we reported 3 new cases.
Yeah.
Yeah, this is the situation as of now.
Okay. And according to the latest information from the Ministry of Health, there's been other measures that have been put in place, such as banning passenger flights in and out of the country effective 20th March. Why did you decide to do that? Why that move?
The decision is justified by the fact that most of our cases are imported cases. The majority of them, they have history of travel in the last 14 days, even more, a little bit. It appears that we are getting cases from outside, from out the country, the majority of them. And then when we monitor their contacts here in Rwanda, we just see that it's become a problem because some of them are arriving without any symptoms. They meet a lot of people and with high risk of transmission of the disease to their relatives, friends, and others. Yeah. The decision of stopping or banning passengers' flights is to avoid that we continue to receive cases from outside. Yeah.
Should these numbers continue to grow, do we as a country have the capacity to continue testing or the preventative measures?
We do have capacity and we are increasing the capacity, but the objective is to stop transmission, avoid to reach the point of community transmission for this disease. That's the goal that we have to avoid to reach that situation. Otherwise, we are increasing progressively our capacity to test and treat those who are infected.
Based on all these measures that are being put in place, should Rwandans worry? What is the message that you're putting out there as the Ministry of Health? Okay,
it's clear that the disease is there and it has a lot of consequences. We should take it seriously, but we should not panic. The Ministry of Health, the government is supporting for stopping this infection, and we believe that if we all comply with the measures that Ministry of Health released since more than 2 weeks, definitely will contain this disease.
Okay, and how are the patients that are in quarantine so far?
So far, they are in stable condition. They are okay. They have some minor symptoms. We treat them, and we wait until their viral load will be cleaned. And it might take 2 weeks to clean and then to release them. So far, it's good. We don't have any patient in ICU, in intensive care units. It means we are treating properly those who are with us already.
Okay.
Yeah.
What's the message you're giving Rwandans right now?
The message is, again, as I said, is to comply with all preventive measures that were issued by the Ministry of Health. It starts by washing, avoid to breathe whoever you are meeting, avoid gatherings where you might have a high risk of getting contaminated by different persons. So basically, it's just stop transmission among people. This is the key message. Avoid unnecessary trips in and out. Yeah. Basically, if we comply with all of these measures, clearly we'll contain this disease. Yeah.
Thank you very much.
Thank you.